Welcome, everybody. My name is Brad Holland. I'm the CEO of Cedar Park Regional Medical Center. I'd like to welcome you this evening to the 6th Annual Bariatric Symposium and Fashion Show. So thank you all for being here. It's a monumental event, not only for the people that are here, but for the hospital, but also for our runway models. And so again, it's a proud moment for me personally, and I know it is for the people that are going to participate. This year is also a milestone in the history of the hospital, in the sense that the hospital became an accredited bariatric center of excellence through the American College of Surgeons. This achievement was made possible by the quality outcomes of our program, as well as the dedication of bariatric surgeons and our skilled team members. This program has helped our patients to lead healthier lives, and I am proud to be a participant in tonight's festivities. This evening and the events of today would not be possible without the contribution of the following. I'd like to thank Covidian, the NFL Hope Foundation, Strativa, Chico's Fashions, Stella and Dot Jewelry, Avenue 5 for hair and makeup, and the Cedar Park Center. I'd also like to thank the Cedar Park Surgeons Associates, as well as the Cedar Park Regional Medical Center Associates, the marketing department of the hospital, and all those that also participated in the tailgating activities prior to the event. Tonight could not be possible without the vision of one person. Dr. Nicole Basa is the medical director of the bariatric program at Cedar Park Regional Medical Center. I'm going to be honored to introduce Dr. Basa, but many patients couldn't participate tonight, nor could we be bragging on the outcomes of the program or the vision for the program without this individual that words can't outline the contribution that she's made to the program. Dr. Basa earned her bachelor's degree from the University of California, Berkeley, and attended medical school at Rush Medical College in Chicago. She completed her general surgery residency at USC, where she was voted Chief Resident of the Year by the surgical faculty for her outstanding patient care and excellent surgical and teaching skills. Dr. Basa is fellowship trained in minimally invasive surgery and bariatric surgery from the University of California, Los Angeles, UCLA. She currently serves as the Assistant Clinical Professor in Surgery for the Texas A&M Health Science Center College of Medicine. Dr. Basa is the medical director of Cedar Park Regional's bariatric program and has been an integral part of the medical staff of Cedar Park Regional Medical Center for over 7 years. Dr. Basa performed the first fully robotic gastric bypass ever to be done in Central Texas and the second surgeon to do so in Texas. Dr. Basa is in private practice at Cedar Park Surgeons, along with her husband, Dr. Alan Abondo. There, this dynamic husband and wife team provide excellent specialized surgical care in the areas of breast surgery, minimally invasive, and Da Vinci robotic surgeries to include hernia, colon, gallbladder, and weight loss surgery. Dr. Basa is dedicated to providing guidance to her patients to achieve success with her weight loss goals. And almost more importantly, they have their little boy Luke here, who I think opened this with the testing of the microphone. But I'd like everybody to welcome Dr. Nicole Basa.
Thank you, Brad. So this is the first time I get to do my slideshow without a clicker, and I'm kind of lost, so bear with me. But I want to thank the Cedar Park Event Center. I also want to thank Brad and Laura, and also Jordan, who've been very helpful in getting this set up. This is an awesome venue to have it done here, and we are all so excited. So I wanted to thank definitely the Cedar Park Event Center for letting us have our chance to do this great event here. So I usually talk about bariatric surgery, and I have my slideshow prepared, but I'm not going to talk too much about bariatric surgery because we need to get to the crux of the show, which is Barrett Brooks and Dr. Roberts over there, who flew in from New Jersey. And so I want them to have their chance to give us their experiences. But to start off, I'm going to talk about our program, and there are two procedures that we do at Cedar Park Regional. It's the Roux-en-Y gastric bypass and the sleeve gastrectomy. So when I talk about the models, I'll mention what procedure they had done. And on the next slide, you'll see some of the indications for bariatric surgery. And this is what the criteria that we focus on when we select people who are good candidates for bariatric surgery. So that's a body mass index greater than 40 or a body mass index greater than 35 for the medical problem like diabetes, high blood pressure, or sleep apnea. This right here is a picture of the Roux-en-Y gastric bypass, and basically what it is creating a small stomach pouch and then bypassing an area of small intestine, so you have malabsorption as well. So you have two mechanisms at play in this procedure to help one lose weight. The great thing with the gastric bypass is that it helps to resolve diabetes because of that area that you don't have much absorption, which is right next to the pancreas. It helps to reverse diabetes actually within days after surgery. So somebody who's been on insulin for a few years or more with multiple other medications for diabetes, we actually take them off of it right after surgery. So definitely there's a physiological mechanism that the bypass helps to reverse diabetes. The next procedure is the sleeve gastrectomy, and the sleeve is basically creating a small stomach pouch, and that's causing basically restriction, so you feel full sooner and you really have smaller portion sizes, but it also helps to decrease your hunger by decreasing a hormone called ghrelin, which is secreted by the stomach that makes you super hungry. So it's definitely a very good operation for long-term success as well. And with the sleeve, you typically lose about 65% of your excess weight, which is, if you're 100 pounds overweight, you lose about 65 pounds. With the bypass, on average, is about 75 pounds per every 100 of excess weight. So these are some of our statistics. Our program has been in existence since 2008. About a year after the hospital opened, we started our first surgery. These are some outcomes of how improvement of a lot of medical problems have happened in a lot of our patients. So diabetes resolution's been 100%, high blood pressure 95%, high cholesterol 91%, and sleep apnea at 94%. And this is up to date as of August 2014. So definitely you can see how these medical problems have improved with bariatric surgery. This is our complication rate. So definitely a low complication rate. In terms of complications, the only thing we've had so far is bleeding, which is 2%. All the rest of them, the leak, and the PEDVT is a blood clot that some patients can get. And then our mortality rate is 0%. So let me knock on some wood for good luck for the future that it continues to stay low. This is our average weight loss per time period. And you can see there at about 2 to 4 months, about 44% of excess weight loss is performed by that time. 5 to 7 months, it's 56%. And at 1 year, 70%. And at 2 years, 69%. This is taking all the patients together, both sleeve and bypass. And so as of yesterday, we calculated how much weight loss our patients have had over the years. And we've calculated that 7,686 pounds have been lost since we started our program, which is about 3.8 tons. And to keep it in, thank you. I mean, it's all these guys right here. It's not me, so I haven't lost much weight, but you know. So to keep it into perspective, it's an elephant weighs about 2 tons. An African elephant can actually weigh between 4 and 8 tons, and Asian ones weigh a little bit less. So, so we could have lost two elephants. So now I want to talk about what are the components of our bariatric program. We've had a lot of success, and as a surgeon, I'd like to take all the credit, myself and Dr. Abondo over there. We'd like to say that it's all surgery, but you know, a lot of weight loss has to do with other things, other components, you know. And so we have a multidisciplinary program at Cedar Park Regional, which is why we have what's called a program. We have individuals who are experts in diet, individuals that are experts in exercise, and we also have psychologists that helps with a lot of that emotional eating. So these are some of the classes and preoperative education that our patients get. Not a lot of patients get the amount of education that our patients get before they actually go to the operating room. We do 4 classes beforehand, teaching them proper eating habits and exercise. We also provide support groups that we require them to start before they actually go to surgery, and we continue that afterwards. And our dietitians are awesome because they provide one-to-one dietary consults prior to surgery to help them to start losing weight. And then afterwards, they can just call Jareen, hey, I don't know a good full liquid recipe. Can you tell me one that has a lot of protein? And they'll just give you a whole list. So they have access to these professionals at any time that they want, which is invaluable. And like Brad had mentioned, we've been accredited as a center of excellence. And this is a huge distinction for any hospital to achieve. And we are the first hospital and only hospital currently to be credentialed with a center of excellence in Williamson County. So definitely congratulations to the team. I had the opportunity to spend some time with a reviewer who came out from University of Chicago to evaluate us, and he actually took back so many different tips from our program, labeling all our bariatric equipment, to our classes, to our education. He was really impressed. So definitely our team has created a program, a great program together, and I think it's unparalleled actually to a lot of the other programs around. So, so I'd like to introduce the bariatric team. So I'll name you guys, and you guys have to come up here too. I want to start off with Amanda Baskin. She's our new bariatric coordinator. Diana Campos, definitely come up too. She was our previous bariatric coordinator who helped us get through the Center of Excellence, so she definitely needs an applause as well. We have our dietitians. We have Jareen Gray, Karen Salinas, and our new addition, Jessica Fowler, who is a part of our team. Our physical therapists can't be here, but Brittany Perdue and Lindsay Johnson. And I want to give a special thanks to that man over there with our baby, Dr. Alan Abondo, who is my partner. And I don't know if patients realize, but they get the benefit of having 2 bariatric surgeons at all their surgeries. So not only am I doing the surgery, but Dr. Abondo is, running the camera, holding the stomach exactly the way I want it to be held, and it makes the case go a lot smoother. So Dr. Rabondo has been instrumental in this program as well, so he should actually be up here too, but I'm sure Luke will try to climb down the stairs or something like that. But so this is our team, and this is our program. So you guys all deserve an applause. Does anybody want to say anything? You have the mic. Free mic time. Jareen, you look like you want to say something. Okay.
We have an awesome program here. Look at these lovely ladies. You all look just beautiful, but it really does start with our surgeons. So thank you.